and welcome to another episode of the Health Show Live Surgery here on the Islam channel. Now, if you're tuning in for the report, it'll be on your screens later on tonight. Now, on tonight's show, we'll be showcasing something rather unique. An alternative to traditional surgeries, we'll be bringing you a live cupping procedure. Now, cupping, also known as hijama, was developed thousands of years ago, and although the techniques have modernised, the original philosophy remains the same. But before we go any further and explore this procedure, let's have a look at what our last show was all about.
Surgery I did this morning, we had 4 patients who were virtually blind from cataract. Their cataracts are very dense, very difficult to deal with. The ultrasound probe can sometimes have difficulty melting and breaking up the lens itself into fragments, as you'll see here. It won't do it as easily. Trying to get the opening in the lens capsule can also be difficult. So it does, each individual cataract presents its own challenges. So this is the 3rd incision going in.
So how many incisions are you making?
Generally 3.
3. Okay.
Generally 3 for a routine case. Now you see the blood coming, that's not coming from inside the eye, that's actually the blood vessels on the surface of the eye. You can see all the red on the white of the eye, that's those little blood vessels bleeding.
And what's the sort of liquid that you put on there? So
this is, once you cut into the eye, the liquid that fills the front chamber, the aqueous, leaks out. To maintain the shape of the eye while we do the surgery, we inject, effectively it's a little bit like egg white, very clear, transparent fluid, which stays where it is and it maintains the shape of the eye while we carry out manoeuvres inside it. So that thick stuff is now maintaining the shape of the eye so it doesn't collapse when I introduce instruments into it.
Wow, wasn't that just amazing? And you know, it's great to know that you can find specialists in eye care who are dedicated to helping people with cataracts within the NHS. And if you have any questions regarding your eyes, then please do email us on healthshow@islamchannel.tv. So on with tonight's show. Chronic pain can occur in both young and older people throughout their lifetime. Many of us take painkillers and sometimes often use ointments and gels, which we can then massage into our muscles. Sometimes, however, these traditional forms of treatment don't always work. An alternative to such treatments is cupping, a procedure which we'll be witnessing live later on in the show. Now, with us tonight, we have our studio audience who, along with you at home, will get to watch a patient receiving the cupping treatment. Also joining us in the studio is Dr. Ayaz Farhat, a GP and a director of the London Cupping Clinic, who provides cupping therapy sessions to people suffering with chronic pain and many other issues. Now, while Dr. Ayaz guides us through the cupping procedure, his colleague, Dr. Munir Rivalia, will carry out the procedure. But right now, let's find out a little bit more about the London Cupping Clinic and what they have to offer people with long-term chronic pain.
Cupping is extracting dirty or stagnated blood from your body, and it's a cup that goes on your skin, and it's actually this cup that collects the dirty blood and then it gets thrown away.
Cupping is based upon rectifying and regulating the whole body. The injury is probably one of the best results showing treatment because the injury is local. So when you apply cup to a local painful part of your body, immediately you see results because it's an immediate inflammatory response of the body, so you get an immune response straight away.
In terms of patient problems, a vast majority of patients actually have chronic pains. A chronic pain is a pain that you've had for a long amount of time and it's repetitive. We find that a lot of patients, when they have no other option, they turn to cupping, when in fact cupping is one of the things that gives them the most amount of effective and long-lasting relief.
The advice I give to my patients after treatment is that they need to let their body do the healing. So in order to do that, they have to improve their diet. At least straight after the treatment, I tell them to take it easy with foods and rest. When a patient comes to the London Cupping Clinic, my approach to help them is not based solely upon cupping them. As a matter of fact, I take time to first decide whether cupping is for them, and not many people, but I have turned away just a few because they have come thinking that their problem can be cured with cupping. And when I say that, I don't mean that medicine is the answer. What I'm saying is that their lifestyle is completely inappropriate and they need to do something about it. And the two simple things that go hand in hand with cupping are your diet and exercise.
Wow, fascinating stuff. But I'm sure, like me, many of you watching might be a little bit apprehensive about cupping. So to put your fears at rest, let's speak to Dr. Ayaz now to get a better insight to the world of cupping. So first of all, we talked about it being thousands of years old. I mean, this has been mentioned throughout the world. Tell us a little bit about how long it's been around.
So we don't know precisely when it started, but we do know that there's cupping in all the civilizations throughout history. So ancient history talking about the Egyptians, so Tutankhamun, there's a theory that he had cupping based upon analysis of his body. Ancient Greece, through the Roman times, medieval times, and then the sort of legacy of cupping got passed through to the Arab culture, and it exists still throughout the world in various geographies. Still there.
Well, we'll talk a lot more while the actual procedure's going on, but we're just going to go to the clinic and see Dr. Avalia, hopefully, and our patient, Narula. So, hi, guys.
Hi there.
Hi.
So, first of all, we need to ask our patient, Narula, how are you feeling?
I'm feeling okay. Thank you.
Now, this is the first time you've never actually experienced this before, have you?
No, this is my first time.
So, in terms of your particular situation, tell us what you're hoping to achieve out of cupping this evening.
Well, I have some mid-back section. My back is hurting a little bit in the mid, so I'm hoping to get that removed through cupping.
Okay, and so Dr. Avalia, very, very quickly, this is a fairly standard procedure for you, I presume, is it?
Yeah. I mean, it's a simple complaint that patients present with and should be dealt with fairly
Okay,
simply.
well, we'll come back to you a little bit later on, but in the meantime, we're going to take a quick break. So don't go anywhere, because when we return, we'll witness a live cupping procedure. So see you shortly. Welcome back to another special health show, Live Surgery, where on tonight's show, we'll be bringing you a cupping procedure live. Now, we would like to remind our viewers to be aware, as there will be some blood during the show, which some of you may find disturbing. Now, we're actually going to go over and have a little look in just a second in the preparation stages. So we can see there Dr. Avalia is actually starting the process. So what will he be doing now?
So, I mean, we're privy now to the sort of skin preparation phase where he's just ensuring that any bacteria or any superficial dirt on the skin is just removed. He's about to make cuts, so the skin needs to be cleansed. We probably missed the initial aspect of when we consult, which is making sure that it's safe to proceed in the first place. Dr. Avalia, any clinician would ask questions based upon medical history, any medications, what they want cupping for, obviously, to make sure that it's appropriate for the procedure to proceed.
Because I presume some people will come to you with an idea of what cupping is, but not actually fully understand, so you have to go through that process to actually ascertain whether it's right for them.
Sure. So the logistics of it are usually they get that information on the phone sometimes. Sometimes it will be in the clinic in this setting, as you're seeing. But we need to go through a triage process to make sure that there's no contraindications for their treatment to go ahead, which has happened rarely, but it does happen.
Now, what's happening now? This obviously seems a little bit more of a high-tech method to maybe the old days. So could you explain what's actually happening?
So this is the initial cup going on to create that suction, lifting the skin up, lifting the skin upwards to create the blood pressure coming up towards the surface of the skin. So you can see now that raised skin is red, it's higher. I don't know whether you can make out that there's a bubble of skin there. If you zoom in, yeah, there you go. So all the blood is rushed to the surface because of the pressure that Dr. Ravalia had with that cup and the wire attached to it.
And of these cups themselves, are they? How will they be cleaned and sterilised first?
So they come to us sterilised, so we will order them in bulk, obviously, and they're only one use. So once we've used them, we dispose of them using sort of the clinical standard to get rid of clinical waste, and that's how they're disposed of. So it's pretty easy for us. It's a bit heavy in terms of recycling, getting rid of all the material, but nothing is reused in the clinic. It's one use only.
And this pump is basically creating a vacuum, I suppose, inside the cup.
So the white tube is just to create a bit of distance to allow the dexterity of the hands to do what they want, rather than being right next to the cup. And yes, so this pump that's in Dr. Ravalia's right hand, he's using that to create pressure, negative pressure, to lift up the skin.
And what's the sensation? What will the patient be feeling?
So this is probably the most painful part of the process. It might be counterintuitive. This is more, potentially, for many patients, a bit more painful than the actual cuts because this is pressure. It's a tightness around the skin.
So, but not overly painful, just a bit uncomfortable.
No, not overly painful. I mean, we've treated around 3,000 or 4,000 patients and not one of them has had to stop because of pain. So this is not overly painful, but it's a pinching pressure that's there right now.
And the placement of the cups, that will obviously depend on the treatment that's required.
Yeah, so the placement of the cups completely dependent on the condition that's being treated, where the pain is, and what the patient wants, as well as what the clinician feels is appropriate. The one point that we can't see right now, but which is in the upper neck, is almost a key point. We almost always do that point. We almost always cup that point. In all the textbooks, from old to now, this is like a key meridian point, center point for doing hijama.
Now, I can see Dr. Valia's actually talking to Nurullah. What will he be telling him at this stage?
Calm down, don't worry. I mean, we're not privy to what's going on, but he's probably just asking whether it hurts. Are you feeling comfortable? Maybe getting a bit of background information on how Nurullah is with blood. So some patients, the sight of blood will make them faint or feel queasy. There are probably people in the room that are similar.
I can see some people are getting ready to shield their eyes when that moment comes.
And other people come into the clinic wanting to see the blood. They want to see what it looks like. That's what they've come in for. And they've got...
Well, talk us through the actual philosophy behind it. What's it actually doing?
So what cupping or wet cupping therapy hijama is designed to do, and the purpose of it, is to remove blood from the body for the betterment of the remaining blood circulating. So we are removing toxic or dirty blood selectively from the bloodstream.
OK, well, we're just going to go over to Dr. Avalia, if he can hear us.
Hi there.
Hi. So all going to plan, I presume?
Yeah, all fine. The patient's comfortable. We just applied the initial vacuum. That's sort of bringing the congested blood to the area. And then actually, in a moment, I'm going to be starting making this all small paper cuts, as they call them, with the incisions.
So is the amount of time in between the initial cupping and the cuts, is that a set time, or does that depend on the individual?
No, this is completely patient-dependent. So if I see the area become erythematous or red like this, it means he's quite a good reactor. So I'm probably actually quite ready to actually start the incisions now.
OK, well, we'll let you carry on with your part, and we'll carry on discussing here. So that the philosophy, as you were saying, was all about drawing the bad blood.
Yeah, so we're trying to remove dirty blood or old, stagnant blood from key points in the body. The current theory, or the most popular scientific theory, or if you just stop there, we're seeing the cuts now. So Dr. Ravalia's got a very well-formed and over decades now technique of he's making these cuts very, very quickly. So to reduce the pain for the patient, rather than drawing upon every single cut, he's already made the full round of cuts. So he'll do probably about 8 cuts in a second. And that's one line of cuts.
And what are they, just tiny sort of pinpricks almost?
They're about 2 millimeters in length and maybe 1 to 2 millimeters in depth. And there's a line of them, and it's a flurry. And now you can see that's the process now, which is you're seeing it with your own eyes. The blood is coming to the surface. He said that Nurullah was a good reactor because of the amount of blood that came, and this is very quick in terms of how fast the blood is coming out of the skin. This is speedy. I don't see this very often. And
will the blood actually, you know, we talked about it being dirty blood, will it actually look significantly different to our regular blood? Would you notice it to the naked eye, for example?
So, to the trained naked eye, yes, to a certain extent. I mean, there is a lot of hype around the type of blood that comes out, and people will claim that they can tell, you know, what you've had for dinner and, you know, what your habits are based upon what they see in the blood. A lot of that, from my experience clinically, is blag, if you like, or gamesmanship, trying to build a rapport with the patient. But you can tell based upon the speed and the colour and how fast it clots, the health and the lifestyle. We're seeing, again, it's good to just have an idea of how fast these cuts are being and the precision with which they're being done. This is, he's going from right to left so that his fingers are not going past any point again. And it almost feels like he's tickling him with the blade.
Yeah.
But those cuts are real, and you'll see blood coming out. And
But I suppose they're such fine cuts you would actually probably hardly feel them.
Yeah, so I did say at the beginning that the actual initial pressure is what I find the most painful. In a trained hand, that's more painful than the cuts because they're so quick, they're not very deep, the blade is sharp, we're only going to use it once and it goes away, that you don't really feel the cuts.
OK, well, we're going to... I guess now he sort of stays there for a while and lets it sort of drag out. So we're just going to ask Nurullah if he can speak to us. Well, no, maybe not speak to us, but can you give us a thumbs up if you're feeling OK?
It's a good sign.
That's always a good sign. Well, I noticed he didn't actually flinch much at any stage, so clearly can't be that uncomfortable.
So, I mean, part of it is building the rapport with the patient. So I'm sure whilst we weren't listening, Dr. Ravali was telling him what to expect, and that's part of it. But the cuts themselves, they're so light that they're not that painful.
So if someone went for a procedure, from the moment they arrive at the clinic, how long before they actually start the procedure and how long before they can leave afterwards normally?
So do you mean how long are they in the clinic for? Yeah. So typically a patient will be in the clinic for an hour to an hour and 15 minutes if it's their first time. Mm-hmm. A good proportion of that is spent talking to the patient, getting the history, establishing what we're going to do, and creating a plan, and just getting them comfortable and familiar with what can be a daunting, a premise of what's going to happen. Hopefully you can see that, okay, there's blood and there's, it is what it is, but Nurullah didn't really flinch, and it wasn't particularly painful. The procedure is quick and it's effective. It's doing what we want it to do.
Now, we said earlier on that this goes back thousands of years, and there's a lot of faiths that put an awful lot of significance into hijama, and of course it's called different things in different faiths. Sure. So that is quite a significant aspect of this.
A very significant aspect. I mean, we mentioned faith and geography as well. So there are names for hijama all across the world, from Russia to Poland to Malaysia, Indonesia, Pakistan, India. In terms of religion, there is a good good volume of text in Judaism about cupping. They go into details about when cupping should occur, the role of the cupper within society. So you will find texts referring to this. Islam, by far and away, it's the most prevalent within the faith. It's intertwined within the religion because many people will just do cupping because it's something that the Prophet Muhammad, peace be upon him, said and recommended. So just for that reason, Muslims will just do cupping.
And how much blood will typically take? I mean, you know, for people who actually give blood, they're obviously used to know that it's absolutely fine to do so. So normally, what sort of quantity of blood would be taken?
So what he's doing, sorry, just to interrupt, what he's doing right now, he's just massaging the skin around to, again, allow for some vasodilations, allow the blood to come to the surface, to encourage blood to be sort of pouring out of these incisions that he's made. May just be slowing down. There may not be enough pressure there, which is why the cup isn't filling as fast as it was when we first saw it. So you can see now that that's static, that blood isn't really flowing out. It's slowing down. So there are reasons for that. Maybe that particular area, the stagnant blood that we tried to get out, that's the limit, and there's not much more going to come. It may be that the pressure in the cup has just gone down. He needs to reapply pressure.
So Dr. Munir, perhaps you could talk us through, what you're actually doing. Obviously, this seems like a regular procedure, the part that you're doing now.
Yeah, so I mean, as Dr. Ayaz was saying, we created the incisions, and the initial blood flow was fairly rapid, especially from this cervical spine 7 area. Lower area is much less, but then this is the area that he's been complaining. His main complaint was this pain in the central back region. So this amount of blood would be quite normal for that, because the inflammatory mediators and sort of the stagnation within itself is built up in these areas, and hence the capillary flow, or the blood flow from the capillaries, would be much reduced. And you may even find after this initial session that he has, if he was to return and have the cupping procedure again after sort of 2 weeks, 3 weeks, 4 weeks, that the blood flow would be hopefully greatly improved in that, and that would show a sign of the healing process, allowing the body to clean out the system. So and I'm just giving it basically just a bit of like a deep tissue massage.
So you're obviously a great believer in the whole system of cupping. So I presume you have cupping yourself done periodically.
Yeah, that's correct. Yeah, and I find it a great energy boost. I don't have sort of any medical ailments.
So who does that? Does Dr. Ayaz do it for you?
Yeah, I mean, my wife does it on me, and I have colleagues that are able to do that on me as well. So it's quite beneficial.
So who's better at it, you or Dr. Ayaz?
I suppose we've got different techniques and different specialities and treatments. So I'll let him answer that one.
Well avoided, well avoided. So just before we go to our studio audience, which we will do in a second, just want to ask you about the frequency of this, because obviously there's bloodletting going on, so obviously you can't keep on going back. So what would be a typical, say for example, back pain? How often would you go, and what would be the limit of how often you could go?
Sure. So, you've mentioned back pain, but just taking a step back, there are many different things that people come from, and it varies because of that, what ailment you come for. For back pain, my advice tends to be you need to try it at least twice over a gap of 3 to 4 weeks. So you try it once as the initial response, and then repeat it again in 3 or 4 weeks to see whether there's This is the main part. I keep interrupting.
Yeah, let's talk about this. What's actually taking place now?
So this is probably the most interesting part for patients, and it's to actually see the consistency of the blood. So you can see that's a big amount of blood, and that's not moving. He's not holding that there. So that's gelatinous, almost solid blood that's staying there. That's part of the natural process of what happens. The body clots blood, and it will stay there. But the speed at which it clots gives an indication to how toxic or how full of inflammatory substance that blood was.
I mean, that is amazing, because you'd expect it to keep on bleeding, wouldn't you? Of course.
And this one looks a little bit more fluid, but we'll find out now how gelatinous it is. I mean, he has his little tricks that he does to avoid spillage, which is a hazard of the trade.
And again, you can see that, it's quite gelatinous, isn't it?
So very gelatinous. I mean, that's there, isn't it? That's not moving. And gravity is not on the blood side. It should be falling down. So what that means is that this blood is full of something called fibrinogen, which is one of the substances that causes clotting and is an inflammatory substance. So that would be in keeping with an area where he has a problem or pain and difficulty. It's not a drastic sign or anything to worry about. It's just an indicator for the clinician as to how successful or how much more cupping is required.
So let's come back to that. We were talking just before he was removing the cups about the frequency.
Yeah, sorry. So for back pain, as an example, my advice or my plan would be have one treatment, get the initial feeling of, you know, a bit of euphoria, a bit of energy boost, and then come back in 4 weeks and then make an assessment yourself as to how well it is. So 2 to 4 sessions maximum.
Right, and how much time in between?
A minimum of 3 to 4 weeks.
Right.
And a maximum of 2 months, otherwise there's no point.
Now, again, we can see this is really gelatinous. What about the actual colour? Is there any significance about that? We talked earlier on about, you know, that to, you know, someone like myself, I wouldn't notice it to the naked eye, but to a trained clinician, you would.
Yeah, so it's, again, an indicator of lifestyle and diet. So the more antioxidants and better cardiovascular system you have, the fresher the blood, the more vitality you have, the blood will come out. He's showing you that this is... it's thick, it's gelatinous, and it's dark. I don't want to condemn Nurullah to having a terrible lifestyle or a terrible diet, but he probably could do a little bit better. It's a sign of... so dark blood is a sign that sometimes goes with smokers or people that don't exercise a lot, because the blood is very deoxygenated. It's not giving oxygen to all of the organs. And the red, fresh blood is a sign of a healthy circulation.
So you get a lot of information from just looking at what you get out of the cupping.
Yeah, so... I mean, we can't give him a prognosis or an outcome as to what's going to happen, but we can use that information to come up with a better plan and give him advice to better his health. Yeah, absolutely.
So now this, I'm guessing he's just cleaning up a little bit. Is there anything else in terms of post-treatment that takes place?
Sure. So depending on the area, so I mean, the back the skin in the back is thick. The chances of any infection are very low because of how shallow the actual cuts are. However, if, for example, Nurullah was a 65-year-old diabetic lady and we had done a cup on a foot, we would be taking a huge more amount of precaution to prevent any chance of an infection, as an example. But nonetheless, he's still doing that. Dr. Munir is doing that, so he's using antiseptic spray, that's chlorhexidine, which is a surgical scrub, just to, again, remove any chance of decontaminant before he potentially covers up the area and lets the initial cuts just heal, which takes about 20 minutes to completely stop bleeding and oozing.
So we'll just go back to Dr. Avalia a second, if he's able to talk to us. You were showing us there the gelatinous nature of the blood, and while you're just cleaning up and sort of, you know, putting the various cleaning fluids there. Yep. Tell us a little bit about what you noticed from the blood there, what it told you.
Well, I mean, this was his first time, so especially from this cervical spine 7 area, we usually find that the blood is quite black in that area, as opposed to that sort of more venous red colour, and that would be quite indicative, not necessarily that he's got a bad lifestyle, but, you know, in everything we eat, there are, you know, these chemicals, pesticides. So this is actually quite normal. And in all honesty, it is sort of the end of the day now that he's had bodily movement throughout the day. So I would expect that volume of blood to come out in him. If I was to do it, for example, early in the morning, when he would have been fully fasted, no bodily movement, we may have got an increased volume of blood. But time of day, it's late in the evening. He's generally quite a fit guy, you know, and he goes to the gym, does his exercise and bits and pieces like that. So this is exactly consistent in what we would expect with a patient of his size, his stature and his age as well.
And I presume in terms of knowing whether he's going to need to come back for another treatment, you know, he will know in what sort of period of time that it's actually I need another treatment or not.
Well, I think the time is a healer, so he'll let us know in the next couple of days. We'll give him a follow-up courtesy call, see how he's feeling. He's obviously going to feel a bit of the soreness and itchiness from the slight incisions that we've made, which is absolutely normal. And based on his symptoms, really, if he feels an improvement, then, you know, we may not necessarily need to treat him again. But if we feel and he feels that he could potentially benefit from another session, then we would obviously plan that, and that's usually planned at the initial treatment planning stage once we've taken his history and decided on what sort of formulation of the long-term frequency that a patient may require.
We should remind everybody that this is actually real time, that we're actually watching this. So this is completely typical of any procedure, although obviously you're placing the cups in different places. The actual process is exactly what would normally happen.
So we all have our own idiosyncrasies and our own timelines for how we do it. Nurula's only got 3 cups. On an average male who's come in, we would probably do more. We'd probably do 9, 10, which would obviously lengthen the time. But in terms of the cups that you saw and the process for that individual cup, yeah, there's very little difference. You asked earlier about the volume that's taken.
Yeah.
When you give blood donation, it's about 300, 400 mils maximum. That's the limit that's set. This is, we're talking a fraction of that, maybe a quarter of the blood in total that comes out with cupping. So it's not a huge amount. It's the blood that you give when you give a donation is venous blood. It's blood that's doing its job in your body. This is blood that's not doing its job, and it gets disposed of. So it's not quite the same as donation, and it's a lot less blood as well.
Now, just a few practical questions that people might have. And we'll come back to Nurula in a while. He looks absolutely fine. A bit of water, and we'll talk to them in a little while. But just a few practical things. Obviously, we've got quite a few women in our audience here. I presume that obviously for women you'll have female practitioners and so on.
Yeah, so the sensitivity across the genders. So we have a policy that our male clinicians will only treat males and our female clinicians will only treat females, just because there can be intimate areas, undressing, etc. And yeah, that's a policy that we adhere to. Yeah.
OK, well, actually, we mentioned our studio audience, so let's actually go to the studio audience now, see if anybody's actually got any questions, having seen that. You're all looking fine. Don't look too shocked by anything that you've seen. So has anybody got a question? Yeah, just over there. We'll just bring the microphone over to you. OK, go ahead.
Is the treatment expensive, and how many treatments do I need?
OK, now the cost, yes.
Sure. So I can talk to you about our clinic. So our price structure is you can expect to pay between £30 and £50, depending on how long a treatment you have, how many ailments you come for, but no more than that. In other places, it varies. I mean, it can go a lot higher in other places, but that's our policies, between £30 and £50.
And again, the amount of treatments we talked about depends, I suppose.
I haven't had the pleasure to ask you what the issues are and why you would come in. It would completely depend upon your symptoms, the conditions that you want treated. It can be a one-off. So sometimes if a person comes in with a migraine, often it's a really fun thing for us to treat, because we'll say, come in when you have a migraine and have the treatment and leave. You don't need to come back. Just and we find that the pain goes at the time of the cupping. As you are making the cuts, the migraine pressure is relieved. And we leave it up to the patient. So for that patient, it's once. However, if you're coming with gout or arthritis, you can't really expect a problem that's affected you for a decade to be resolved in an hour. So our plan usually involves 4 sessions over 6 months, something like that.
But you would notice a difference after the first treatment.
So the first treatment invariably leaves people energized because their bloodstream is lighter. We've removed the heaviest aspects of that blood, the most rich inflammatory cells that are there. So your bloodstream is lighter. You feel energized. You're probably just a bit excited because you've tried this crazy thing and you want to talk to people about it, and there's some positivity there. And yes, your symptoms do improve, especially of pain. But for chronic pain, for symptoms that recur and have troubled you or plagued you for many years, it needs a longer-term approach.
OK, great. Any other questions? Anybody? Yeah, in the front here.
Is cupping carried out on children? And I have another question, if I may.
Yeah, sure.
Is there a time where the body's more receptive to cupping?
So, 2 very interesting questions. With regards...
So just in case people didn't hear, we're talking about children. Is there a minimum age? And then is there a part of the body where it's more receptive?
A part or a time?
Time of the day.
Oh, the time of the day.
Sure. So, with regards to children, firstly, I mean, we have to be sensitive to the peculiarities of where we're based in the UK. Now, there are issues that come about in terms of this is not a common therapy, and we don't want parents or children having marks on their bodies and people worrying that there is something that's not safe going on. So we're quite sensitive to that. So only myself, a doctor, or like Dr. Munir would treat children, just to make sure that we are covering ourselves. We do treat children for many conditions. For example, chronic asthma from a childhood age, or allergies, things that are really troubling a 7, 8, 9-year-old, migraines, another example. So we do treat children, but we do it with a lot more sensitivity, a lot more time, and specialist input. Dr. Ravalia runs a pediatric club, which is designed, the whole ambience of the clinic changes at that time. It's a lot more jovial, and it's for him. Sorry, I've forgotten your second question.
About time of day, time of month, time of year.
Sure.
Are any of those things affecting
It's interesting. We mentioned other cultures and other religions. All of them, the Chinese culture, if you look in Judaism and Islam, they all talk about the moon as being this epicenter of when you should do cupping. And we know from medicine that the moon affects many things. Cycles, mood, they can affect many things. The word lunatic, it's probably a bad example, comes from the moon, yeah? But so we find that for general health or to prevent illness, and even for the treatment of certain conditions, times around the second half of the month when the moon is waning, are good times to have cupping done. And that's within the traditions of Islam as well.
Well, I see that we're back in the clinic there. We've got Dr. Munir and Nurullah. So first of all, I suppose we should come to you, Nurullah. How are you feeling?
Yeah, not bad, thanks. I'm feeling a bit lighter and a bit more relaxed, especially from my back.
How uncomfortable was that? You didn't seem to flinch too much, but tell us how it really was.
It was okay. Parts of it were just a bit ticklish, if anything. It didn't really hurt, and it was it's just a pressure that you don't expect, but it doesn't hurt.
So, Dr. Munir, this obviously you treat. We heard earlier on sometimes up to 8, 9 different patients a day. So, how many do you think you've actually conducted in your career?
I mean, it must be running into over 1,000 and something like that. Yeah, quite a number now over a period of years. But I suppose as the time goes on, I'm treating more and more people with more sort of weird and wonderful medical conditions that maybe they've been to their conventional, been to the GP, been to the specialists, and found sort of no cure, and they've sort of come to something alternative like cupping as well as acupuncture and other therapies, and have been benefiting quite well.
As you say, yes, often with chronic pain, people will try absolutely everything. And, of course, they will always go to their doctor first, but they will try absolutely anything. So the word, I presume, is just spreading more and more through word of mouth from people like Nurullah about their experiences.
Yeah, completely, especially when someone has benefited, especially if they've had a chronic ailment. Like you say, pain, pain, as you say, people will go to all lengths to get that pain reduced. And when they benefit, then, it only spreads, they tell their friends and the family, and, it spreads like wildfire already. And that's what we are seeing, an increased number of patients coming for multiple conditions now, yeah.
OK, well, I'm going to actually open up to our studio audience to see if anybody actually wants to ask either of you a question about what you've just seen. Is anybody who would like to ask anything from either our patient, Nurullah, or Dr. Munir? Yeah, we've got a question over there. We'll just get the microphone over to you a second to make sure everyone can hear.
Where can I get this done?
So we set you up for that one or what? So the question is, so are you available for bookings by any chance?
Yeah. People can go onto our website and book online, or call our booking line within the working hours. And there's multiple sites, so it makes it geographically more convenient for the patient within the London region to be able to visit one of our clinics.
Now, obviously, people will be watching this from all over the country and, for that matter, around the world.
Sure.
There's a lot of different practitioners out there. What are the sort of questions that a potential patient should ask a practitioner to make sure that they're getting the best treatment? Are there any sort of golden rules that they should be thinking about?
Well, I think it's multifactorial in the sense that obviously if someone has a medical background, a healthcare background, a nursing background, that is obviously beneficial, especially when the patient is presenting maybe with a complex medical condition with comorbidity. So just so they feel in safe hands. And obviously, just like anything, they want to know the experience of that practitioner, how long they've been doing it, maybe sort of where they trained, which institute they've been to, multiple questions like that, just to give confidence to that patient that they're going to be treated in the best, safest and most efficient manner.
And, of course, for ladies who want to make sure they're going to be looked after by a female practitioner, obviously that's a question they need to ask.
Yes, correct. Obviously, different clinics work in different ways, and we provide specialist clinics for the female patients, and we have female clinicians, doctors, and nurses alike to be able to assist them with the cupping therapy.
So when people first hear about cupping and they've maybe read something online or talked to a friend about it, what are usually the first few questions that people will ask, maybe misconceptions or preconceptions that they have about the whole procedure?
Well, definitely there's that fear element, just like with anything. It's, it is involving blood, it's involving sort of incisions, so there is that sort of fear element. But I think once people can see examples of patients that have been treated quite safely and have come out okay, then they feel more confident with that. There's no drugs involved. It's allowing the body to heal itself. We're just giving basically a boost.
Well, it's been great to watch. Thank you so much. First of all, I think we need to give Nurullah a big round of applause for subjecting himself to all of us watching him. And, of course, to Dr. Munir as well. Thank you both very much indeed. Fantastic. Thank you. One more time for them both, please. Thank you very much. Wonderful. Now, it is amazing, and again, just to remind everybody, that was live. That did actually happen as we saw it in real time. We've talked a lot about back pain. You talked about migraines. What are the sort of other things that people come to you for and they think that cupping might be able to help?
So we have a full spectrum. You mentioned back pain and migraines. So pain, I'd say a third, maybe a half of patients that come with some kind of painful condition, be it ankle, knee, back, shoulder, neck, etc. Then you have conditions, high blood pressure, cholesterol, problems with fertility, women's cycles. All of these issues, people are either curious or they're desperate to find a way to treat. So, yeah, the whole range.
So a lot of different things. Well, I'm sure there's a ton of questions that people have, and I'm sorry to our studio audience. I know there's a few more of you who had a question that you wanted to ask, but sadly we're running out of time. But it's been absolutely fascinating to watch the whole process and to actually watch it live here in the studio. So absolutely brilliant. Thank you so much indeed for bringing it to us.
Thank you for having us.
Thank you. Absolutely amazing and fascinating to watch. And what an opportunity to be able to learn more about this unique procedure. And I think it's safe to say that the passion and dedication provided by the team at the London Cupping Clinic is clearly evident. And if you are considering cupping as an alternative therapy, it's really good to know there's such a great service provided right here in London. Now, it's also reassuring to know that you're in the capable hands of medically trained therapists as well who carry out cupping on a daily basis. Now, as I said, that's sadly all the time we have for on tonight's Health Show Live Surgery. So a big thank you to Dr. Farhat. Thank you very much indeed. Big round of applause, I think. Fantastic. And also, of course, to Dr. Avelia as well, and all of the team at the London Cupping Clinic for guiding us through such an intriguing procedure. And as always, thank you to our studio audience and to you at home for watching. And if you do have any questions about tonight's show or would like to know more about cupping, please do get in touch. And you can do that by emailing us at healthshow@islamchannel.tv. And until next time, thank you so much indeed for watching. Good night and assalamu alaikum.